Welcome to another season of the Aced It podcast, where we turn science into sense. In this season, we are introducing you, our listeners, to some of the Justice Community Opioid Innovation Network, or JCOIN, family. In episodes 1 and 10, you will hear from our funder, the National Institute on Drug Abuse. And in episodes 2 through 9, you will learn about cutting-edge and recent science published by some of the investigators working in the Learning to Advance Practice, or LEAP, program, a part of JCOIN. This is so exciting. So let's get started. I'm Danielle Rudes, your host, and this is Aced It. On this episode, we're tackling a critical issue, often left unseen: the struggle with addiction faced by pregnant, incarcerated people. Did you know that nearly 4% of incarcerated women are pregnant upon entering jail or prison? That's roughly 3,000 women entering prisons and 55,000 entering jails each year. A shocking statistic. But even more alarming is the fact that 70% of these women meet the criteria for a substance use disorder. Today, we will dive into a recent study by Steely Smith and colleagues titled State Laws on Substance Use Treatment for Incarcerated Pregnant and Postpartum People. The findings of their systematic search are concerning, and it is very important that we spend some time learning more. We will be using the term pregnant people throughout this episode. This is because the study we are referencing utilizes this language, but also because it is a more inclusive term. Using pregnant women excludes transgender and non-binary individuals who may also become or be pregnant. Pregnant people acknowledges the diversity of pregnancy experiences and ensures everyone who can be impacted is included in the conversation. In the main study for this episode, Steely Smith and colleagues found that most states and countries have no laws specifically addressing substance use disorder screening and treatment for pregnant people in their correctional facilities. Even the few states or counties with such laws often use outdated language and lack clear guidelines for comprehensive care. This means that pregnant people are regularly denied access to evidence-based treatment for substance use disorder, including medication-assisted treatment, or MAT, or medication for opioid use disorder, MOUD, a major public health concern. National guidelines recommend screening all pregnant people for substance use disorders regardless of incarceration status and providing appropriate referrals, but this is simply not happening in most correctional facilities. There is a legal debate surrounding whether substance use disorder qualifies as a, quote, serious medical need, unquote, that institutions are obligated to provide. This ambiguity creates a huge barrier for these patients, or soon-to-be parents. As far as viable solutions are concerned, Steely, Smith, and colleagues discuss the existence of federal funding opportunities that divert pregnant people from incarceration and into community-based treatment. These programs offer a chance for people to receive comprehensive care while staying connected to their families and preparing for parenthood. However, Steely Smith and colleagues found that these resources are often underutilized by states. In another study, Essence, Hairston, and colleagues in their article titled A Call to Action, Person-Centered Care Aligned with Reproductive Justice for Incarcerated Pregnant People with Substance Use Disorders. These researchers discuss a practice called safekeeping. Safekeeping is when pregnant people experience mental health issues, medical complexities, or addiction, and they are transferred from jails or prisons for supposedly better medical care. However, for those with opioid use disorder, safekeeping can be detrimental. Maternity care in jails is often limited, and prisons often lack the resources to provide comprehensive care for pregnant people with opioid use disorder. Importantly, access to medically assisted treatment can be disrupted during transfers. This lack of continuity in care can have serious consequences for both the parent and the babies. Hairston and colleagues reported that studies show disruptions in MAT can increase the risk of relapse and overdose for the patient, while newborns exposed to opioids prenatally may experience neonatal opioid withdrawal symptom. Ultimately, The issue of safekeeping for pregnant people with opioid use disorder highlights the need for broader reform. A system where comprehensive and evidence-based care, including medication-assisted treatment, is available in both prisons and jails would be ideal. This would eliminate the need for disruptive transfers and ensure continuity of care throughout pregnancy. When considering what can be done, Steely Smith and colleagues mentioned the need for a two-pronged approach. First, states need to adopt clear and comprehensive legislation mandating substance use disorder screening and evidence-based treatment, including medication-assisted treatment, for pregnant people in correctional facilities. Second, states should take advantage of federal funding to support and expand diversion programs that offer alternatives to incarceration. Likewise, Hairston and colleagues mention their own solutions for pregnant people with opioid use disorder in carceral settings. These include implementing integrated prenatal clinics in jails and prisons, expanding access to behavioral health services and specialized addiction treatment, supporting breastfeeding and lactation services for pregnant parents who are in custody, and enacting policies that respect the dignity and rights of pregnant parents and their infants. The lack of adequate support for pregnant people with addiction in our correctional system is disappointing, but it need not remain this way. We need to push for reforms that ensure these parents receive the care they need both for their health and the well-being of their children. We've established the importance of providing adequate substance use disorder treatment and prenatal care to pregnant incarcerated people. Now let's consider the significant harm that can be caused to unborn children due to the lack of such care. Research has shown that infants born to mothers with untreated substance use disorders face numerous health risks. These infants are at greater risk for developing neonatal abstinence syndrome, or NAS, in which the baby goes through withdrawal upon birth, as well as impaired physical development, health, and growth. They are also at significant risk of poor cognitive functioning and psychiatric disorders. So, ensuring that pregnant people who are incarcerated receive proper treatment is not just about the health of the parent, but it's also about giving their children a fair and healthy start at life. This is a solution that benefits us all. Thank you for listening to the ACED podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, JCOIN, their Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters on this season, Sam Houston State University doctoral students Alexa Mata and Bryce Kushmerik-McCune. And a huge and heartfelt thank you to Jason Luchin and the team at Zielinski LLC for their amazing production. Tune in again soon for another episode of ACED It.